So we will start first using the sensor holders for the upper and lower anterior teeth, and when you receive these from the sterilization, you will receive them disassembled. So you need to assemble them again, and this is a very simple procedure. All what you need to do is that you align the notch in the common groove and then you rotate it either way. At the end you should have, as we said earlier, this relationship. For purposes of demonstration, I will not use gloves. Ideally I should be using gloves on patient, as you know. And second, I'm not going to use a sensor. I will use the regular film that we used earlier, the analog film. When it comes to the thickness of these films, they are very similar to the PSP or the phosphor stimulated plates. So I will just substitute these with the regular film, and I'm going to use the size 1 due to the size limitation of our mannequin. So this video will demonstrate the use of the sensor holders, the green ones. So ideally they will be used for the upper and lower anterior teeth. This sensor in particular is, as you can see, it has a it's open from this, it's not a solid block, so it is open, and this is used, you can use it for endo, which is the ideal sensor or the sensor holder that you can use in endo, because what it does, it allows the holder, the file or the reamer that you're using during your endo work to extend through the, I'm just simulating this to a file or a reamer, so that you can, the patient can bite on the tooth and the reamer can extend. So you can do your working length with the presence of the file. However, you need to remove the frame from the patient so that you can reflect back the rubber dam and insert the sensor inside the patient's mouth, as will be demonstrated now. So when you receive your PSP from the nursing doc, it should be, of course, wrapped in a disposable cover, and then you're going to insert the sensor into, or slide it into the sensor holder, making sure that the exposure side, and I repeat this, so I will keep on repeating this because we find some cases of the sensor being placed on the other side. Sensors always are written in a way that it shows the exposure side. So the exposure side should naturally be facing the ring. If this is the exposure side and this is the back side of the film, so in the sensor you're going to use, you will find here exposure side. So you slide the sensor into the groove over here, and then you're going to slide it all the way down until you match or you align the lower border of the sensor with the two arrows over here. These arrows will mark the end of your sensor positioning. You cannot insert it before these, otherwise you will have a cutoff from the crown. And periapical, you know that we need a radiograph that extends, that fully shows the crown and the root and the periapical area excuse me, for the tooth. So if you fail to align the lower margin of the sensor with those rings, you will have a crown cutoff. Okay. After this is aligned, okay, then you're going to place it inside the oral cavity. And when you place it inside the oral cavity, if you're doing an endo, you remove the frame and you reflect back your rubber dam, so that you will, even with the presence of the clamp. You don't need to remove the clamp. This will allow the placement of the sensor with the clamp. You reflect the teeth that you want to examine. Let's start with the central incisors. Before you insert this into the oral cavity, you better have a look inside the oral cavity to see or get acquainted with the anatomy of the area. If there is anything that might interfere with the placement of the sensor with the holder. And then you ask your patient to open wide so that you allow to allow the insertion. When you insert, please follow this procedure. You flip back or you flip down the sensor, and then you insert it. Make sure to take this away so that you will not annoy your patient by touching this area, and you insert it all the way back. Utilize the space in the oral cavity, okay? And then when you reach back, flip it down, making sure that you extend it all the way back. And then you ask your patient to close on the area that or the tooth that you want to examine. And then you slide this and align it in a way. See, I'm doing the central incisors now. The central incisors are the exact center where they are biting on the block. The sensor now is exactly behind those two teeth and at the same time parallel to them. And the ring now here, which is you approximate it to the patient's as much as you can, to the patient's face or skin, and then you ask him to bite gently on that holder, just to guarantee that it will not fall. So, this is now, when this is done, you just bring your cone and you align it with the ring, and you ask the patient not to move. See, this is the way of alignment. Now the x-ray, you're 100% sure that it is perpendicular on both the, I'll just rotate it again just to show you what's going on. So when you ask your patient to bite, see, this is what's happening. Tooth and the sensor are parallel, and then you ask the patient to bite, and the x-ray is going to fall perpendicular on both of these structures. Okay? Once you're done, you ask your patient to open wide, and then you just reverse what you have done in the beginning. You just flip down or rotate down, utilizing, as we said, the space inside the oral cavity, and you pull it out. By so doing, you're not going to touch or irritate the patient. Mind you, these are bulky, relatively bulky holders, and for sensitive patients, you have to tell your patients ahead of time is that I'm going to use this, and show your patients so that they will know or they will have an idea about the placement and the objects that are going to be inserted inside the oral cavity.